Okay, today's topic is sensory neural hearing loss. First of all, we have two types of hearing loss. We're talking about hearing loss. First one is conductive and the second one is sensory neural. The conductive is usually a problem when there is a problem in the outer or the middle ear. However, the sensory neural hearing loss is when there is a problem in the inner ear. And that would either consist of the cochlea or the nerve. And the disease I'm talking about here is noise-induced hearing loss. So for the exam, if you don't have time, so the question will ask you which of the following is the most likely cause of this patient's hearing impairment. So if you know that the disease is noise-induced hearing loss, so basically the question is asking which of the structure in the ear has been damaged. And the answer is cochlear hair cells. One more thing for the exam, if you are rushing and you don't have time, so the exam will ask you, is it at the base of the cochlea that the hair cells will be damaged, or is it at the apex of the cochlea? Because we have two types of hair cells. And the one that is damaged in the noise induced hearing loss is at the base of the cochlea. And what's the function of this hair cells at the base? It detects high frequency sound. In the exam, if you want to remember it quickly, remember bass, loud music reminds you of this instrument which is called bass. Now, if you have time, let's study a little bit about the disease. So the problem is the loud noise that will damage the hair cells. It will do so by two mechanisms. First one is called mechanical damage, and the second one is metabolic overload. What do I mean by mechanical? So if you're constantly hearing loud noisy music, this loud music will cause strong vibration in the ear, and then the strong vibration from the noisy sound will break the delicate hair cells in the cochlea. And what do I mean by metabolic? Again, if you're constantly hearing loud music, this will make the hair cells work harder and will have high metabolism, and high metabolism means high metabolites to high toxic metabolites that will accumulate over time and will damage the hair cells. So in the exam, in the question stem, you will have somebody who is working in an occupational noisy environment. Give me an example for someone who's pilot, especially if they're driving jet engine, whether that's combat or non-combat. Other professions like manufacturing or mining, where there are lots of noises from heavy vehicles and other machines. The next question, when the patient comes to you, is the hearing loss unilateral, only in one ear, or bilateral? Of course, with logic, there will be bilateral hearing loss because you don't hear only from one ear, you hear from both ears. So the patient will have difficulty hearing in both ears. And the next question, once the damage happens, is it reversible or irreversible? Unfortunately, irreversible. So there is permanent hearing loss, and when you treat such patients, your management is aiming at preventing further loss. That's why in big countries like America, Britain, and some parts of Europe, if you have an occupation where there is loud noise, then you are required to have some protection equipment like earplugs, and also there is a screening hearing evaluation every now and then. Finally, let's talk about the hearing loss itself. Is it sensory neural or conductive? I have answered it in the beginning of the video. It's sensory neural hearing loss because the problem is in the inner ear, in the cochlea. The next question is, which one is affected? Of course, when we speak, we have low frequency sound and we have high frequency sound, which are both completely different from the volume. So if I'm talking like this, high, it's different when I'm talking high, which is loud. So this is the volume. The letters themselves, the letters can be low frequency and high frequency. An example of high frequency is these letters, S, F, Sh, K, H. So these are called high frequency sounds. The low frequency is everything else. So when you hear the bird chirping or tweeting in the morning, this is high frequency sound. And in the noise-induced hearing loss, usually what's affected, it starts with high frequency. If the patient continues the exposure to the loud and noisy environment, of course other hair cells will be affected, and the patient will have also problem hearing the words of the low frequency sound, and also the volume will be affected. So even if you are shouting at them, they will not be able to hear. This will only happen if there is a continued exposure of the noisy environment. Usually start with the high frequency sound. And that's why when you say something like how are you, they might not understand they might not be able to hear the letter H, and the way they will hear it is how are you, and that's why they have difficulty understanding speech. And when you try to speak loud, they will say, don't shout, I can hear you. In fact, what they cannot hear is just the high frequency, but the volume is not affected at the beginning of the disease. Does the noise-induced hearing loss occur only from one session? Let's say, for example, you go to a disco and the music was loud. Does it happen only from going once to the disco, or does it happen when you go several ones or several times? The answer is usually happen after years. So in the question, you will have somebody who has been working as a pilot for 8 or 10 or 20 years. So it doesn't usually happen after 1 month or 2 months, so be careful in the exam. So here is a question you can read by yourself. Just note at the end, the question says bilateral and there is high frequency sound loss. And I'll finish this video by differential diagnosis. A lot of people, sometimes in the question, choose the answer paratrauma instead of noise-induced or cochlear hair cell damage. So you will have a patient who's a pilot who has been working for 10 years, and you examine the patient, and the patient have a sensorineural hearing loss. So how do you differentiate? Is it the paratrauma or is it cochlear hair cell damage? In cochlear hair cell damage, the examination, everything is normal. So the patient will not have vertigo, will not have tinnitus, and when you examine the middle ear, it's normal, tympanic membrane normal, external ear is normal. While in paratrauma, what does para mean? Para means in Latin pressure. Trauma is when there is changes in pressure that will affect the ear and cause damage, especially with pilots, because when they fly, they go from low pressure, and then when it's a very high altitude, the pressure is very high in the ear. So there is extreme change in the pressure, and this pressure will affect both the middle ear as well as the inner ear. So that's why when you examine the patient will have problems in the middle ear and conductive hearing loss, as well as a sensorineural hearing loss, because the inner ear is also affected. That's why when the patient comes to you, as I was saying, there is middle ear problem from the pressure. And this is usually effusion or a problem with the tympanic membrane, because the tympanic membrane, when the pressure is very high, it will compress the tympanic membrane inward. And then when they go to a low pressure, it will go outward. So tympanic membrane keeps changing. As well as there are fluid in the middle ear, because of the pressure, the middle ear cannot get rid of the fluid inside the middle ear. As well as from the pressure, the patient will say, I feel there is some pressure in my ear, and sometimes feel ear pain. And that was the end of the video. Thank you.